Now moving towards the properties of cementum. So let's start it. Bismillahirrahmanirrahim. So first property we'll discuss the permeability of cementum. So the acellular cementum and cellular cementum both are permeable, and actually they let the diffusion of dyes from the pulp and the external root surfaces. And we also know that the cellular cementum they have actually canaliculi, and also in some cases they are contagious with the dentinal tubuli. So, and also one important point that the permeability of cementum diminishes with the age, means it finishes with the time, with the age. Okay, now moving towards another important property, which is actually cemento enamel junction. Cemento enamel junction is basically it is of very important clinical significance during the root scaling procedures. Okay, it has actually three important relationships that you have also studied in your first year. One is basically 60 to 65% cases overlap when the cementum overlap the enamel. In 30% the age is to age but joint exist, and 5 to 10% the cementum and enamel fails to meet. In the last case, where cementum fails to meet, is actually gingival recession, and that actually may result in attenuated sensitivity as a result of exposed dentine. If the patient is feeling sensitivity, so means your dentine is exposed and there is actually gingival recession. You can see this picture actually where they show the normal morphology of cemento enamel junction. The space between enamel and cementum, like this, where actually the cementum has overlapped the enamel. It is 60-65%, where cementum enamel meets actually to 30%, and where actually they fails to meet, where cementum and enamel fails to meet, so it is 5 to 10%. It is due to the gingival recession, so the patient also feels sensitivity at that area. Now Cementodentinal junction. The terminal apical area of cemento where it joins the internal root canal dentine is known as cementoenamel junction. It is also very important during the root canal treatment when it is performed. So the obturating material should be at the cementodental junction, means this material should be here. Okay. And there is no increase or decrease in the width of cementoenamel junction with the age, as it was with the permeability of cementum, that it diminishes with the age. Okay, then it the width appears to be remain relatively stable. Okay, the cementoenamel junction is 2 to 3 micrometer wide, and it has also the fibril poor layer that contains significant amount of protoglycans and fibrous that is intermingled between the cementum and dentine. So it has proteoglycans, and also they have actually fibrous that is intermingled with between the cementum and dentine.